many residents in Camden, New Jersey, the need for health care is pressing. But the challenges of daily life often take precedence over the much-needed medical services. Struggling to pay the bills, to put food on the table, and to stay safe are just some of the concerns affecting this community. Dr. Belodia, what are some of the greatest challenges in providing health care to this Camden community?
I think the biggest challenges here in this community are probably so many barriers. There's financial, there's psychosocial. They have trouble getting to us. Transportation is an issue. They have trouble affording medications, seeing specialists. They don't have resources, family support. There's a learning barrier, so a lot of them don't have diplomas or high levels of education, some even reading problems. A lot of the adverse events and trauma that they see, it's amazing. This is one of the poorest cities in the country, definitely probably one of the most violent cities too in the country, so a lot of challenges.
Camden is considered a food desert, meaning residents don't have access to fresh produce and ingredients. And unhealthy foods are often cheaper, leading to an increase in chronic diseases.
We see a lot of diabetes, a lot of obesity, a lot of heart disease. There's lots and lots of care that needs to go into those chronic conditions. So a lot of that's learning about the disease and getting more education.
So it's access to care, access to quality foods, and access to information?
Yes, yeah.
Virtua's Kyle Will Family Health Center, located in the heart of Camden, is working to reverse some of the major obstacles that prevent Camden residents from caring for their health. They work to meet the patients where they are, physically, mentally, and emotionally.
How you been?
A little rusty.
A little rusty.
They help individuals make better choices for themselves to improve their own health.
Jerome is a patient of mine who really cares about his health and who's gone through a lot of challenges, really come through and improved a lot on his general medical health.
I even lost weight. I lost 125 pounds.
He changed his eating habits, and I saw the difference in it. He was walking, exercising.
During the summer months, Virtua sets up a farmer's market in the city so that residents can buy fresh produce that they otherwise wouldn't have access to.
I go to the farmer's market because it has all fresh fruits and vegetables. It's near my home. And they have a dietitian out there, a nutritionist.
What have you learned from talking to nutritionists, from taking the cooking class?
I've learned that food can be cooked in a nutritious way. And after the class, you're sent home with a bag of nutritious food and the recipe to cook that meal. We cook it here too. So I'm excited about that, to learn how to cook food a different way, because when I was growing up, there's a certain way you cook food. Slapped a lot of lard in the pan. My age, we use lard. And my mom threw the chicken in, and that's the way it went. So now I've learned how to, fix foods a lot of different ways and really make them taste good.
Perhaps most importantly, the medical team here understands that individuals can't focus on their health until their most basic needs are met. So community-based health managers work with patients outside of the clinical setting to help resolve issues like hunger and homelessness.
One of the times, the community-based health manager actually helped one of my patients get housing. This patient came in and she was in a troubled situation in her home, and then, through resources that otherwise we wouldn't have been able to know about, she was able to secure at least 1 year of housing, for this patient.
How much of this for you is building trust with the patient?
Oh, trust is so important, I think, in primary care. I think that's the foundation. It really doesn't go anywhere unless you have their trust, because it's besides meeting their healthcare needs, they have a lot of other issues going on, and we have to understand those issues and build a trust that we understand what's important to them. So the more we get that level of understanding going, everything gets better.
Behavioral health is another important area that the center has focused on, specifically for the children in Camden. I'm here with Amy Quick, who's the director of the CASTLE program here at Virtua. Amy, what is the CASTLE program? Describe it.
The CASTLE program is a behavioral health program. We service children from 3 up to 15 years of age, and our job is to provide good quality therapy for children who have behavioral and emotional problems, who are struggling mostly in school and sometimes at home.
What are some of the challenges that they're dealing with at home that impact the behaviors you see in the classroom?
It's not just the home, but it's the environment. It's their community. I think when we talk about children who are living in the city of Camden, they are faced with different challenges than children in other areas. So there are stressors in the home, which everybody faces. Parents who may be getting divorced or loss of family members. But here in Camden, they're also dealing with violence in their community. So there is a higher level of anxiety here, depression, PTSD. So we are working very hard to be sensitive to their specific needs.
I'm a grandmother raising two of my grandsons with some behavioral and learning disabilities, and Castle is providing me with services to help me raise them.
CASTLE, which stands for Children Achieving Success Through Therapeutic Life Experiences, provides therapy and counseling services in a classroom setting, but with more one-on-one support than the kids would receive in a regular classroom.
We do provide school for them 2 hours a day, but the rest of the day is about learning how to socialize better with their peers, learning how to manage their emotions better. We have a lot of children who are dealing with anger management, difficulty expressing themselves, so they're learning a lot when they come here.
In order for the CASTLE program to work, parents and guardians must be involved in the children's therapy.
Our job is to also help reconnect relationships between mothers and their children when they've been disconnected for so long because of all the turmoils at school or the frustrations the parents are feeling. And here we have a moment to educate the parents about what their child is going through and about what they need and how they can support their child.
By me being knowledgeable of the situation and of their disabilities is helping me to be sensitive to their needs and helping me not to be so overwhelmed and, stressed, and to be able just to function more effectively.
One of the things that we're proud about is that we are a very consistent, safe environment for them. And when they come here, you actually see them wanting to come here. They form positive relationships with their peers, with the staff here, and you really see a change in them. We're a short-term program, so they'll be here for about 2 to 4 months, and to see a change in 2 to 4 months is pretty powerful. It's powerful for the families, for the patient, and also for the staff as well.
I see the difference in my grandchildren. Whereas they were out of control, and now they are learning coping skills, they're learning how to be independent. As I see them grow and change and use the tools that they're learning here to build their self-esteem, it builds my self-esteem. And that's very important. It's very important.
Life and Living has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and NJTV. Funding for this edition of Life and Living with Joanna Gagis has been provided by Bank of America, Horizon Blue Cross Blue Shield of New Jersey, Johnson & Johnson, the Give Something Back Foundation, New Jersey Sharing Network, NJM, and by the Russell Berry Foundation. Life and Living with Joanna Gagis has been produced in partnership with St. Joseph's Healthcare System.